Good afternoon, Dr. Yasser.
Good afternoon. How are you?
Well,
Looks interesting case.
it's a normal case, not very so interesting case.
Okay. So it's multiple stones.
Can you see the points?
Yeah.
Yeah, it's the patient has one kidney stone, two small urethral stones, and a large urethral stone in the left side. And 3 weeks ago, we have already dealt with the left side stone. So now we'll do the flexible ureteroscope on the right side.
So you will do bilateral, yes?
No. 3 weeks ago, we have already deal with the left side.
Left side.
Yeah. Now we'll deal with the right side.
Okay, perfect. So are you planning to remove that double J on the left side in this time?
No, I don't think so. I think we'll remove the stents altogether next time. I just confirmed with my colleagues. They say they can remove the left side stents.
Okay.
It's an uncomplicated last operation.
Perfect.
We're waiting for other doctors from.
Okay. So let me. LV, do you know how many are connected with us now from Libya?
Hello, Dr. Yasser.
Hi, LV. Good morning.
I think they're joining us. I'm checking with them. Just to wait for 1 or 2 minutes. I will get back to you.
Okay, perfect.
Hello, Dr. Yasser.
Hello, how are you?
Good. So nice to see you again.
It's my pleasure.
Today we will have 2 live surgery, and Dr. Tu will perform this operation.
Hopefully next time I will be with you in the
in
operating room.
the operation room.
I hope next time I can be with you in the room.
Yeah. I think this 2 operation is just a regularly operation, and the young doctors do them every day, so I just select. Actually, we have around 10, more than 10 surgery, and we just arranged to pick it up two of this live surgery.
Perfect.
So can you see the picture?
Yes, this is the second case, yeah?
Yeah.
So the first one was on the left, on the right
Yes,
side.
Yeah, so the first one patient had ureter stones in both sides. And we have removed the left side stone. So today we removed the stent, the WG stent. And 3 weeks ago, we also performed insert the DGS tube in the right side.
The size of the stones is 5 millimeter.
Yeah, you can see the stone. The stone is not a large one, but for if you can see this in the CT scan, actually there are stones both in the right ureter and the right kidney. And 3 weeks ago, we found there more than 1 centimeter ureter stone. But actually, there's, in fact, there's 2 small stones located together in the right ureter. And we also can find a very small stone in the right calyx.
Okay, so can you just explain to us the protocol for these small stones? Are you giving a chance for expulsive therapy or spontaneous passage?
Yeah, I think actually we can make a choice for the patient to ESW or use some medicine. But we can see this picture 3 weeks ago, there's mild hydronephrosis. And, and because we can see actually there are 3 small stones in right side, kidney and ureter. So I think it should take 2 or 3 times for ESW. So and actually, if we are lucky, we maybe can do the ureter flexor uroscope, and that's only 1 time to remove all 3 stones.
Okay.
So maybe we can show how to use the basket to lecture to remove the stone.
Are you still also preferring the large sheath in such a case? 12, 14?
Mm-hmm. Yeah, usually we use the 14 inches. It's a routine one for us, and actually it's very easy for us to insert this way. But we do not like to use the safe guide. So I think Dr. Zhu will show us how to do the digital unit scope and how to put in the cheese. And I think I will ask Dr. Zhu to do every step slowly and show us very clearly.
Okay. Actually, I had a case yesterday, and it was difficult even to insert 1012. Even after double J stent for 2 weeks.
Do you do the freestanding just for one time?
Excuse me?
Did you, I mean, freestanding?
Yes. He was pre-stented for 2 weeks, and then even 1012, it didn't pass above the pelvic brim. So the 1214, it's really in our practice, in our region. I don't know, maybe different population, but it's really very rare to be able to insert 1214.
So which side of the stand did you use?
1012. I know it's difficult to move with the scope inside freely. Sometimes it's very tight. And also I do understand that irrigation or backflow is not optimum.
I mean, what side of the stand did you use? 5 or 6 flat? Okay. Yeah, 6 flat. We also use a 6 flat.
Yeah. I think maybe the ureter in our region, in our population, may be different than in China. I don't know. This is something we should figure it out, because.
So is there any difference between the cheese we used and you used? I'm not sure. It's the difference. It's the same cheese.
Actually, I use the sheath from Coloplast, and sometimes I use from Rocamed.
Yeah.
I know you are using Cook.
Yeah, I use Cook.
Yeah.
And actually, we just as because we do not use safe guide, so this is only one lumen. I mean, just one luminous fluid, not two luminous fluid. So maybe this is there's a difference.
Yeah. The wire which I use with Coloplast, you know, it goes from side the channel, so it's outside the sheath.
So Dr. Wang will show you the cheese we use.
Yeah.
Yeah, Dr. Yasser. This is our 1214 sheath. The only one channel for the guide wire.
Yeah, I know it.
Yeah.
So you can see there's some Chinese word. Chinese words they marked in the package. This is means female, male, not female, male.
Yeah.
That means this long one. It's usually around 45 centimeters.
Yeah.
And if the patient is a female, and we will use short one.
35, yes?
Yeah, 35. Because after we are freestanding, and the ureter will become more large and more straight. So the user time, it is easy for us to put in the cheese. So if the cheese is long and 45 for female, and it is has a higher risk to the kidney injury.
Yeah.
So usually we will check the before we use the cheese.
So, LV, can you update us about our colleagues in Libya?
Hello, Dr. Yasser. Now
Yes,
we
LV.
have 7 doctors here together with us.
Okay.
If we start in about 1 or 2 minutes, then we can start the live cases.
Yeah, because I see everything is ready in the operating room.
Yeah, it's okay for us.
Yep.
It's okay for us, China.
Now it's 3:19 p.m. We can start 1 minute later, 3:20. Okay, Dr. Yasser.
Perfect.
Thank you.
稍微慢一点，图可以放慢一点，不行。
So for post stenting, Dr. Lee, how long do you keep the stent? After the procedure, for how long do you keep the stent?
Usually we put the stent for 2 to 3 weeks before the flexible ureter.
After flexible, 2 to 3 weeks.
Oh yeah, after yeah, we will remove the stand after the remove the stand. Usually we take 3 to 4 weeks after the flexible ureter. And usually we will check the KUD X-ray. If we cannot see clearly, we will also check the CT scan.
Okay, but do you think 3 to 4 weeks is long time?
You mean that it's too long?
Yeah.
Yeah. Actually, the operation is very smooth, very successful, and if we believe all stones have been removed completely, and everything is okay, we will sometime we will remove the stand in 1 to 2 weeks.
Okay. I'd like just to share with you what we are doing here in straightforward cases and no significant residual. I will put double J with a string, and in 5 days, it can be removed in the outpatient clinic. If I am expecting some more residual or it's long time operation, I will keep it for 10 to 15 days, not more.
Yeah, actually, I agree with you. Yeah, it's actually 3 or 4 weeks is too long for patient. That's actually the patient with the stents will get some symptoms and get discomfortable. But you know, we do some very complicated stone, such as more than 2 centimeter stones. So for these cases, we will ask the patient to take the stent for more than 3 weeks.
Yeah, I agree with you. But you know, almost we want to work to reduce the number of staged procedure in flexible arthroscopy. You know, the always comparison between BCNL and the flexible arthroscopy, that BCNL in one stage, they can finish, patient is stone free, and we cannot debate in front of BCNL for 2 centimeter stone if I should go for pre-stenting 2 weeks and then maybe flexible arthroscopy 2 stages and putting a stent and waiting for a couple of weeks. It means 3 or 4 procedures which can take longer time, up to 2 to 3 months to get your patient stone free. Guys supporting the BCNL, they said in 24 hours, I made my patient stone free. So we have to find a way to reduce this multiple procedure, staged procedure.
Yes, it's actually we do some surgery, just as you said, for very complicated stagnant kidney stones, because some patients do not like to receive the PCNA. They just like to receive the flexible urethral. So, but if the stone is too large, we will take many times.
I think it's time that we can start.
Okay, we can start. And then,
LV.
Yes. So so everyone, so nice to see you online again. And today we will have 2 live surgeries, and Dr. Zhu will perform the surgery, and Dr. Wang.
切这个应镜的画面，切应镜画面。
Dr. Wang will we will moderate. Will
can you, if possible, if they can show us the room setup quickly, how they set up the equipments and the around theater?
稍微吃得慢一点哈，一点一点来。So first time, and Dr. Zhu will do the digital ureteroscope, and I think he will remove the stent in the left side, which we inserted 3 weeks ago. Dr. Yas, can you see it clear?
There is a slow transmission, but it's clear.
Okay, so Dr. Zhu just use the grasper and remove the stent on the left side. 3 weeks ago, we performed the digital ureteroscope for the stone in the lower ureter of the left side. So fortunately, we removed the stent. So the next step is we use we also remove the stand of the right side.
So usually remove the stent with ureteroscopy or cystoscopy?
Ureteroscopy.
I think it's because the is a small one, in small size, we can easily, and because we just inside and go outside for any time, so we like to use the digital ureteroscope. So the next step, Dr. Zhu will check the right ureter, and I think he will first insert the Y.
Yeah. But, sorry, the image is not clear. It's interrupted and it's not flow in a good way.
用的水嘛，冲的水呀、稍微出的慢一点，出的慢一点。So I maybe the webinar is very good. It's not the video is not smoothly. So I asked Dr. to do it slowly. So Dr. Yes, can you see the ureter?
Yes.
Yes. So you can see after we, yeah, we can see stone here. So after we put the stand for 3 weeks, the light ureter size is much larger, and yes, we can also see where the stone, clearly stone. So we like to push the stone into the light kidney. Okay, so you can see, you can see the ureter is straight,
yeah,
and the size is much big. Yeah, much. I think we put the C wire, and we will just use the one wire. We just use one wire, and we through this wire, we will put in the cheese.
So you are planning to fragment the stone in the ureter, or you will push it back to the kidney?
Yeah, yeah. Actually, because the stone is located in the upper ureter, so I think this is no difference between the stone in the pelvis or in the upper ureter, because we usually just put the cheese in the upper ureter. We do not. Can you see the 慢一点放嘛？慢一点放嘛，你不给他讲清楚，慢一点。放得近，等一下慢一点。So can you see Dr. Zhu has inserted the cheese? Did you see it?
Yes.
So it's very smoothly, very smoothly. It's not. There's no difficulty for him to just put inside the cheese. And
yeah.
If we, yes. So you can see, can you show us, Dr. Wang? 你给它开得近一点嘛，拉近一点。 Yeah. So actually, you can see the fluid come from the cheese. This is urine from the right pelvis.
Yeah.
So after we put into the cheese, we remove the wire.慢一点好了，慢一点。So you can see there are two pictures. One is the video. Yes, I think it's in the up ureter. Yeah, you can see here is in the inside the pelvis. We can see, yeah, you can see the up the middle calyx. Yes. I think it's right now it's in the up calyx. So it shows you the middle calyx. So today we just use the single-use flexible. Yeah, you can see the stones. You can see stones. Actually, we should find 3 stones because there are 2 stones. There was 2 stones in ureter and another stone in the middle calyx. So I think we should take all of 3 stones.
Yeah.
So yeah, we can see, we explore the low calyx.
Yeah, it's very clear.
Yeah, very clear. This is Kepler. Yeah, this usually 3 calyx in the low pole.
Yeah. Are you planning to use basket? They are small.
Yeah, you can
and
see
here.
We can. Yeah, it's two way for us. One way is just use laser or use luminous podium from the luminance. Yeah, but because the stone is not too large, we can also use the basket to remove. Yeah, 你可以小的先掏一下也可以啊。你看看是不是3颗 ？Yeah. We are very lucky that the 3 stones goes into two space in one calyx. Yeah, we found 3 stones in one calyx with small calyx.
Yeah.
So I think
so Dr. Wang is going to.
Dr. Zhu will show us how to use the basket to remove the stone completely, and he will also use the laser to crash the stone into dust. I think use a dusting.
So there is. Do you have a fluoroscopy? Do you have a fluoroscopy in the room in case of you need to have a guide if stone not seen or something like that, or no?
Yeah, we have the fluoroscope right here.
Okay.
It's not working today. Some malfunction.
Because this machine we have used for 15 years. 15 years. So it doesn't work today. But I think we do not use this X-ray every time. I mean, it's not routine for us to use it.
Yeah.
Usually we use this X-ray to check the position of the WS stent after we finish the finish the surgery.
Or if you have a stone enclosed the calyx or in diverticulum, I think fluoroscopy can help to identify the location of the stone.
دكتور ياسر.
السلام عليكم.
دكتور ياسر.
أهلا.
I am Dr. Ali Obeidi من جروب بنغازي ليبيا.
أهلا بيك.
It is possible to introduce the safety sheet without fluoroscopy, without X-ray, and there is another upper ureteric stone.
Let me to ask him. هو بوش الستون في الكدني الأول بالمنظار قبل ما يحط
لما دخل بالسيمي ريجيد شفنا الستون قاعدة في الأبر يورتر still there. And insert the guide wire. After that, he insert the guide wire and introduce the safety, the access sheet without fluoroscopy. كيف نعرفوا إنه ما وصلناش ستون هيك أو وصلنا؟
Although it look like it's stone very small, but for the basket it is a little big and large, and you can see sometimes it is not easy to retrieve it. Again, yeah. Yes. You can see it will block the cheese. How to do that? I tried one time just to remove the cheese with the stone.
Okay.
出来了吗？啊？好，所以你有这个卡拉就这些整个串都带出来了，出得来吧？不是，你得推着看起来，不要假呀，你推着拉出来就完了。这不行，放那种激光胆嘛。
So, Dr. Lee, we have a question from our colleague, Dr. Ali from Libya. He's asking during insertion of access sheet, especially if you have a stone in the ureter, he feels that it's more safe to use fluoroscopy during insertion of access sheet to avoid complicated pushing the stone against the wall of the ureter to make trauma or something. What do you think? So I can just repeat the question.
Because the luminous machine make a large noise.